At the Atlantic County Division of Public Health, our mission is to promote healthy behaviors, prevent disease, and protect the health of all who live, work, and visit Atlantic County. 5 service units make up the Division of Public Health. The services provided by the Environmental Health Unit are based on the functions of investigations, inspections, and sampling. To ensure it is safe for beachgoers to swim, ocean and bay water were sampled and tested from May 16th to September 11th. Public pools and lakes were also inspected to safeguard bathers. Registered environmental health specialists inspected all 1,676 restaurants in the county, along with the campgrounds, youth camps, body art establishments, kennels, and tanning facilities. They investigated potential sources of air and water pollution, along with public health hazards such as vermin, rabid animals, and lead paint. The Environmental Health Unit tested private drinking wells and reviewed plans, performed inspections, and issued permits for new septic systems. The unit also responded to hazardous material incidents and other public health emergencies. The Geographic Information Systems, also known as the GIS program, was used to map, organize, and maintain information for public records. It has proven to be an effective tool for identifying environmental health trends and concerns such as groundwater contamination, rabies exposures, and West Nile virus. GIS also serves as an educational tool to help you visualize various health issues in the areas in which you live. The health educator and nurses in the Community Health Unit are very busy running clinics and programs that provide education, screening, treatment, and immunizations. In October of 2017, the unit also assumed most of the public health services in Atlantic City. Our children's health is very important to us. Our Well Child Immunization Clinic is available to children 18 years and younger at our Northfield and Hamilton locations. Every child care center, preschool, elementary, middle, and high school was audited in 2017 to make sure students were up to date with their immunizations. In August, immunization training workshops were held for child care centers and preschools, and in September for elementary and high school nurses to learn about immunization requirements. Our child health services also include lead screenings and special outreach involving home visits and family health counseling. In September 2017, New Jersey's reference level for elevated childhood lead exposure was lowered, which resulted in more children being identified as having an elevated blood lead level. As a result, more cases needed to be managed and required more intervention. Adult vaccines and flu shots were available to county residents. Flu clinics were held at locations throughout the county in September to November. 1,170 flu shots were administered. The prevention of cancer, heart disease, and diabetes was managed through blood pressure, cholesterol, and blood sugar screenings conducted at health fairs and in our women's health, men's health, and Live Stronger, Longer clinics. The Women's Health Clinic also provided Pap tests and referrals for breast cancer screening. Over 350 women have been seen and more than 200 prescriptions were written for mammogram testing. Sexually transmitted disease testing, treatment, and education clinics were held Monday afternoons. 703 patients were seen and 574 HIV tests were performed in the clinic. 47 tuberculosis clinics were held in 2017. In those clinics and during the week, a total of 419 patients were seen for evaluation and treatment. Community health nurses also investigated and tracked outbreaks of communicable diseases to help reduce its spread. In 2017, 335 individual cases of diseases were reported and followed up on, and 17 outbreak investigations were conducted. The unit's health educator also planned, implemented, and evaluated community health education programs throughout the county on topics such as smoking cessation, healthy eating, and physical activity. The Health Planning, Information, and Preparedness Unit focuses on preparing for and responding to incidents of bioterrorism and other public health emergencies. The unit created and revised public health emergency plans and managed Medical Reserve Corps volunteer recruitment and training. The New Jersey Local Information Network and Communication System was used to send out 6 health alerts, 15 health advisories, 31 health updates, and 154 health information messages to appropriate public health staff and external partners that include local, county, state, and federal government officials. First responders such as police, fire, EMS, and the Office of Emergency Management, health systems and care providers, pharmacies, colleges and universities, service and community organizations. The unit also plans, implements, and evaluates community health education programs that are based on findings from youth and adult behavioral health risk assessments conducted with the Partnership for a Healthy Community. These assessments allow the unit to update the Community Health Improvement Plan. The Substance Abuse Service Unit coordinates drug and alcohol prevention and treatment programs. The unit supports the Volunteer Municipal Alliance coordinators with program planning and reporting. It conducts programs that evaluate and educate persons convicted of driving under the influence of drugs or alcohol. The unit also provided the Fatal Vision program in schools and in the community, along with a variety of community health education programs. The animal shelter provides housing to stray animals while attempting to reunite them with their owners and facilitate successful pet adoptions. The shelter participated in the second National Clear the Shelter Day and the Brandywine Valley Mega Adoption Event. Shelter staff educates the public on responsible ownership and provide free obedience classes for dog adoptees. Controlling the spread of rabies in the community is a public health priority. Free rabies vaccination clinics are offered monthly. 1,540 animals have been vaccinated in Atlantic County. Low-cost spays and neuter programs are also available. The shelter is open 7 days a week. For more information about the programs and services provided by the Atlantic County Division of Public Health, visit our website at www.aclink.org.